Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Pharmacology. Mandy, a patient calls the clinic today because he's taking atorvastatin, Lipitor, to treat his high cholesterol and is having pain in both of his legs. You instruct him to. Option A. Stop taking the drug and make an appointment to be seen next week. Option B. Continue taking the drug and make an appointment to be seen next week. Option C. Stop taking the drug and come to the clinic to be seen today. Option D. Walk for at least 30 minutes and call if symptoms continue. Right answer is Option C. Stop taking the drug and come to the clinic to be seen today. Muscle aches, soreness, and weakness may be early signs of myopathy such as rhabdomyolysis associated with the HMG co-reductase class of antilipemic agents. This patient will need an immediate evaluation to rule out myopathy. Additional doses may exacerbate the problem. Exercise will not reverse myopathy and delays diagnosis. Which of the following adverse effects is associated with levothyroxine, Synthroid, therapy? Option A. Tachycardia. Option B. Bradycardia. Option C. Hypotension. Option D. Constipation. Right answer is Option A. Tachycardia. Levothyroxine, especially in higher doses, can induce hyperthyroid-like symptoms including tachycardia. An agent that increases the basal metabolic rate would not be expected to induce a slow heart rate. Hypotension would be a side effect of bradycardia. Constipation is a symptom of hypothyroid disease. Which of the following adverse effects is specific to the biguanide diabetic drug metformin, glucophage, therapy? Option A. Hypoglycemia. Option B. GI distress. Option C. Lactic acidosis. Option D. Somnolence. Right answer is Option C. Lactic acidosis. Lactic acidosis is the most dangerous adverse effect of metformin administration, with death resulting in approximately 50% of individuals who develop lactic acidosis while on this drug. Metformin does not induce insulin production, thus, administration does not result in hypoglycemic events. Some nausea, vomiting, and diarrhea may develop but is usually not severe. NVD is not specific for metformin. Metformin does not induce sleepiness. The most serious adverse effect of tricyclic antidepressant, TCA, overdose is Option A. Seizures. Option B. Hyperpyrexia. Option C. Metabolic acidosis. Option D. Cardiac arrhythmias. Right answer is Option D. Cardiac arrhythmias. Excessive ingestion of TCAs result in life-threatening wide QRS complex tachycardia. TCA overdose can induce seizures, but they are typically not life-threatening. TCAs do not cause an elevation in body temperature. TCAs do not cause metabolic acidosis. The nurse is aware that the following solutions is routinely used to flush unfold device before and after the administration of blood to a patient is Option A. 0.9% sodium chloride. Option B. 5% dextrose in water solution. Option C. Sterile water. Option D. Heparin sodium. Right answer is Option A. 0.9% sodium chloride. 0.9% sodium chloride is normal saline. This solution has the same osmolarity as blood. Its use prevents red cell lysis. The solutions given in options 2 and 3 are hypotonic solutions and can cause red cell lysis. The solution in option 4 may anticoagulate the patient and result in bleeding. Cris asks the nurse whether all donor blood products are cross-matched with the recipient to prevent a transfusion reaction. Which of the following always require cross-matching? Option A. Packed red blood cells. Option B. Platelets. Option C. Plasma. Option D. Granulocytes. Right answer is option A. Packed red blood cells. Red blood cells contain antigens and antibodies that must be matched between donor and recipient. The blood products in options 2 to 4 do not contain red cells. Thus, they require no cross-match. A month after receiving a blood transfusion, an immunocompromised male patient develops fever, liver abnormalities, a rash, and diarrhea. The nurse would suspect this patient has option A. Nothing related to the blood transfusion. Option B. Graft versus host disease, GVHD. Option C. Myelosuppression. Option D. An allergic response to a recent medication. Right answer is option B. Graft versus host disease, GVHD. GVHD occurs when white blood cells in donor blood attack the tissues of an immunocompromised recipient. This process can occur within a month of the transfusion. Options 1 and the 4th of May be a thought, but the nurse must remember that immunocompromised transfusion recipients are at risk for GVHD. Jonas comes into the local blood donation center. He says he is here to donate platelets only today. The nurse knows this process is called option A. Directed donation. Option B. Autologous donation. Option C. Allogeneic donation. Option D. Apheresis. Right answer is option D. Apheresis. The process of apheresis involves removal of whole blood from a donor. Within an instrument that is essentially designed as a centrifuge, the components of whole blood are separated. One of the separated portions is then withdrawn, and the remaining components are retransfused into the donor. Directed donation is collected from a blood donor other than the recipient, but the donor is known to the recipient and is usually a family member or friend. Autologous donation is the collection and reinfusion of the patient's own blood. Allogeneic donation is collected from a blood donor other than the recipient. Nurse Brian knows that the age group that uses the most units of blood and blood products is option A. Premature infants. Option B. Children ages 1 to 20 years. Option C. Adults ages 21 to 64 years. Option D. The elderly above age 65 years. Right answer is option D. The elderly above age 65 years. People older than 65 years use 43% of donated blood. This number is expected to increase as the population ages. A child is admitted with a serious infection. After 2 days of antibiotics, he is severely neutropenic. The physician orders granulocyte transfusions for the next 4 days. The mother asks the nurse why. The nurse responds, option A. This is the only treatment left to offer the child. Option B. This therapy is fast and reliable in treating infections in children. Option C. The physician will have to explain his rationale to you. Option D. Granulocyte transfusions replenish the low white blood cells until the body can produce its own. Right answer is option D. Granulocyte transfusions replenish the low white blood cells until the body can produce its own. Granulocyte, neutrophil, replacement therapy is given until the patient's blood values are normal and he is able to fight the infection himself. Options 1 and 3 are not therapeutic responses. The treatment in option 2 takes days and is not always able to prevent morbidity and mortality. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.